DNR stands for Do Not Resuscitate, and that's actually a status someone's given in the hospital. It literally can be on your chart, on your file, in the computer, which says that you've chosen not to be resuscitated. But what does that really mean? Well, DNR can mean multiple forms of resuscitation, but let's start with the basic one, which we're all familiar with, which is CPR. So if someone chooses to not be resuscitated, they can specify that they actually do not want CPR. CPR, as we know, are chest compressions where literally someone will go on your chest when your heart stops and press on your chest to keep blood ideally flowing until your heartbeat can come back. The next thing that you can have is what's called ACLS protocol, where we give you medication to deal with different types of heart rhythm. And that's also part of resuscitation. The last thing is shock, where we literally take paddles and we shock your heart if your heart were to stop or go into an irregular rhythm. Those are some forms of resuscitation, which include CPR, ACLS, which is giving you medications through the veins, and then shocking your heart. But in addition to that, to be resuscitated sometimes requires a intubation, which is a big straw is put through your mouth into your windpipe where we can mechanically breathe for you if your heart and lung have stopped. So that's also part of resuscitation. And finally, we can start more medicines through the vein to support your blood pressure if your blood pressure has collapsed.